Good day, everyone, and again, welcome to this webinar on MYLE Patient Portal. My name is Maxime. It will be my pleasure to cover with you the functionalities that have been identified by our users as especially important in the fight against COVID-19, basically how to manage accounts, how to share documents, and of course, how to send communications to patients. Before we start, on my behalf and on behalf of Medfar Clinical Solutions, we would like to thank you for all of your invaluable contribution in the fight against COVID-19. You are on the front line in this war, and we are grateful for that. Of course, you can count on us to support you. We are doubling the efforts to develop new features such as the teleconsultation that will come soon, so stay tuned, as well as rolling out our existing products to our entire community in an effort to support the fight against COVID-19. Ask your questions during this webinar. You can ask your questions by using the section in the right margin that's distant to that. You can there's a little question section in which you can type a question. There's a member in my team that will attempt to answer these questions during the webinar. And of course, at the end, I will go and review those questions and answer some of them for the benefit of all. So let's jump in the content of today's webinar. The agenda of today is first we'll cover what is MYLE Patient Portal. Then we'll jump into how we manage the patient portal accounts and how we make sure that we link them to their patient charts in MYLE. Of course, we'll cover how to share documents as well as send communications. And I'll finish by showing you how you can manage all of the shared items in the portal. So let's jump in. I'll leave my presentation and we'll first cover what is MYLE Patient Portal. So MYLE Patient Portal is an actual web page that is different than your MYLE environment, but that is linked to it. So it's a web address, a bit like your MYLE environment, that has an address that will be similar to your MYLE environment. In my case, it will be demonstration, which is the name of your clinic.portail.medfarsolutions.com. And as we'll discuss later, that's the home page where the patient will go, as we'll see later, to create an account on the portal. I'd like to mention also that for your patients, there's a user guide that they will be able to download by clicking on the Get the User Guide button. So it's really a web address that's distinct from your MYLE environment. And your MYLE environment, in my case, is a demonstration environment that I will use for today's webinar. I'm already logged in as a doctor. And we'll jump into our second topic, which is an important one, is before we start sharing documents and sending communications to patient, it's really important that the patient have an account on the portal, and then that we make sure that this portal account is associated to the patient chart. There are two methods to do that, and we will cover both. The first method is to invite the patient via the patient chart. And we will do an example of that right now. So I will search for a patient that I wanna invite to the portal. And this first method, by the way, is a quick one because you will be able to start it as soon as your portal is activated for your clinic, which should be done over the next couple of hours. So in my case, I'm going to invite a patient that's first name is Maxime. So as I type in the search tool, I'll see that I have, as usual, the different patient charts that correspond to my search. There's a different things now. Once your portal is activated, you'll see that there's an account there's an icon that will appear. In my case, what I can see is for some of the patient charts, I can see that there's a blue icon. That means that the patient has an account on the portal. If there's a green checkbox, it means that this portal account is properly linked to the patient chart. Whereas if there's an orange circle, it means that the patient has been invited to the portal, but has not yet completed its activation process. In my case, we will invite the first patient, which is Mr. Maxime Caron. So we'll click on the result to go in the chart. Once your portal is activated and you're in the chart, there will be a new button that will appear, which is in the top corner right of the screen. It's an icon with the portal logo. And that will be the button that we will use to invite the patient. When do I invite a patient? A good example is if I'm doing a consult that could be over the phone with the patient, and I want to invite that patient to the portal because I will share some of the results with that patient or send communication. So I can invite the patient by clicking on that icon. Now, what I can see here is that there's already an email address that's linked to the chart. I can use that email address, assuming, of course, that I made sure that this client is okay to contact and that we can send communications to that patient. If I want, of course, I can use a different email, which will be my case. So I'm going to type my email address quickly. From that point on, I can, of course, send the invite, as we'll do, or I could also refuse. You can refuse the access for some patients for some reasons to the patient portal. In my case, I'm going to click on send. Doing that, an email has been sent to my email, and there's an important activation code here that is important to communicate with the patient, of course, after ensuring that I can confirm the identity of the patient. So in my case, I will just copy that because I will need it later. But normally that is communicated verbally, either because the patient is in front of me. You can print it as well. You can print it and give that to the patient. The patient will have a 72 hours window to activate his portal account from the point that I sent the invite. That delay of 72 hours is configurable. 72 hours, we see that it's good for most of the cases, but with your project manager, that will be associated to your project. You can configure that if you want it smaller, if you want it longer, that can be configured. Although we find that 72 hours is a good default time. So I'm going to close that, and I'm going to go back to my email. And now I can see that in my email, I received an email. If I click on it, there's a welcoming message. And it will ask me to activate my account. So I will click. I'm on the patient now, just to do a clear distinction. So I'm the patient. I received that. I will click on activate my account. And it will bring me to that window. So the activation code, and I will just quickly switch to English, is the one that has been provided to me, communicated to me by members of my clinics, my doctors, or someone from the clerical staff. So in my case, I copied it. I'm going to paste that. And I'm going to define myself a password like that. Once that's done, I'll click on submit. When that is done successfully, I can reach my account. So again, I'm the patient here, and that's what I'll see. First step, before I can benefit from the functionalities of the portal, I need to accept the terms and conditions. This is something important. Our team is activating all of the portals right now. We activate them with a default template of terms and conditions that has been validated on all legal aspects by our team. But of course, you will be able to modify those terms and conditions and adapt them to your context. In my case, I will just go quickly at the bottom and accept them. I've read and understood, accepted the terms and conditions. Once that is done, I'm in my account. So that's what a portal account looks like. It's very simple to use. You'll see that briefly. You have the logo of your clinic, if you have one, and you'll have different tabs on the left. One distinct for each functionalities, namely one for messages, for all the messages that my clinic will share with me, appointments, where I'll book online appointments, bills, and another tab for documents, where I'll be able to find all of the documents that have been shared with me. And on the right-hand side, there's a little history of all the recent activity in my account. So that's really how it looks, briefly, the portal account. Now I'll go back to MYLE and close this. I'm back to MYLE. I will now, you can see that if we go back to our icon at the top, it's now blue with an orange circle. Again, that means that we've sent a notification, but it's not yet completed. Although we did complete it at the moment, and it's just because I need to close the chart so that it's refreshed. So if I just actualize my search and I go back here, I can see that my patient Maxime Caron now has an icon that's blue and with a green checkbox, meaning again that the patient has a portal account and that portal account has been properly linked to Maxime's medical chart. So that's how we do the first method, which is to invite the patient via the chart using an activation code. Sometimes that's a question that's being asked. I sent an activation code to the patient. Patient somehow lost that activation code and calls to get that code. Once that is done, I will try with that patient here. If I go back on that icon, I can see that, no, it's not the case right now, but if the activation code has been sent, you will see the activation code in the chart for the duration of the 72 hours. That's really important. Once that is passed, you will be able to send a new code or regenerate a new code for the patient. Okay, so you can always find the activation code in the chart if the patient lost it for some reason. So again, that's the first reason, the first method to invite patients. Second method is to invite patients to go on the login page of the portal and create themselves their account. You can do that in different ways. You can, of course, if your clinic has a website, you can take the address of the portal and put it on your website and invite your patients to go on your website, go into the account and create themselves an account. That's one method. Another method is to do a mass emailing process for all of your patients for which you have the email. You can do a mass email to them, inviting them to go on the page, the main page of the portal, and create themselves an account. That's one way. If you don't know how to do mass email sending, again, the project manager that will be associated to your clinic will be able to support you in that process. So those are the ways to invite patients. I'll do the method just to show you. So I'll go again in the login page of the portal for our demonstration clinic. Of course, if I have already an account, I will type my email, enter my password, and then log in into my portal account. If I forgot my password, again, there's a way for which the patient can recover that password because we already have her or his account. But now I'm a new patient, so I will simply click on the register button right here. That will bring me, so I'll be here, to that page. So it's a standard form really with some fields. The one with a little red stars are mandatory, of course. So you have to fill them and until you can click on register. Some important point here is that if a patient fill his information there, at the moment, it is not linked to the patient chart. Okay, so it will not automatically update the patient chart info. So it's really for the patient to update his or her information, but it's not linked to the patient chart. So that's important to mention at that point. Also at that point, we're not modifying the patient chart. We are only creating for ourselves a portal account. The linking process, we'll do that in a few minutes. So I just fill that. Once that's done, I click register and I can go in my portal from that point as a patient. I'll go back to MYLE. So now in that context, it means that we have many patients that have created their account and they might come at the visit. They already have an account on the portal that we will need to link to their actual chart. Why is it a two-step process? It's because of confidentiality reasons. We want to make sure, remember that we're going to share documents and we're going to send communications with those patients. So it's really important that the authentication process is done properly. But in my case, let's assume that I have a patient that's called Patrick. Okay, so I'm gonna try, and Patrick tells me that he has an account on the portal. So I need to find his account on the portal and associate that to the chart. The distinction here is I'm gonna still use my search tool at the top, but I will not search as usually in the patient charts. I will search in the portal account universe, if I must say, and I'm gonna do that by checking the tick box here, search portal. So if I do that and type Patrick, for instance, I will see all, for the words Patrick, for the first name Patrick, all the accounts that are existing in the portal. Now I have two options. In the case of Patrick Isid, I can see that there's already a blue icon of the portal with a green checkbox. It means that Patrick Isid has an account on the portal and that account has been properly linked to the patient chart already. That also means that if I click on Patrick Isid's chart, I will go directly in his chart because the association has been done successfully. Now I will close the chart. This is different for our patient, that's Patrick Medfar, who doesn't have any icon next to his portal account. So if I click on Patrick Medfar, my goal here is really to match that portal account to the proper patient chart. So now what we see on the left is the information of Patrick Medfar, and on the right-hand side are possible matches for the patient charts in your clinic's database that match my search, which is Patrick for now. I will add my actual name, which is Patrick Medfar. So I can see that I have a chart that already exists for Patrick Medfar. So if I want to match both, it's simple. I click on the chart that I want to link to the portal account, and I click on link, and that's done. It happens that it's possible for your clinic that you open your portal to new patients, patients that do not have an existing chart, therefore in your database. So it's possible that when you're at that steps, you won't find any results. That's okay, that's normal. What you need to do is to create a new chart to associate with that portal account. And you can click that by clicking on the button that's called Create New Patient. So if I do that, what's interesting is now we will capture the demographic information that the patient filled out when he created his or her account. And I can see that it's already filled. I can add, of course, information if I know it, or I can just click on create, knowing that I will update the demographic information once I talk to the clients, or if the client comes at the clinic. So I would just click at that point on the button create. I will cancel that, cancel this. So this is the most important step at the beginning, really, is to make sure that the patient has a portal account and that's properly associated to the patient chart. And as we've seen, there are two methods to do that. Once your portal is activated, there's one that you can start right away, and it's by inviting patients through their chart, so that, and providing them with an activation code that they will use to activate their account. That's one method. You can start quickly. Second method, as we saw, is to communicate through mass emailing or through a web page, inviting the clients to go on the login page of the portal account and to create their own account, remembering that at that step I'll have to do the linking process we just covered previously. Once that's done, we're ready to go. We can start sharing documents and we can start communicating with our patients. So first step we'll do is to share documents with the patient. So in my case, the patient I'll use is Maxime Caron. I have an over-the-phone follow-up with that patient this morning. So I'm gonna click on the appointment again to go in the chart. I click on the name. That part that you probably know at that point. You can share different type of documents to the patient using MYLE Patient Portal, and we'll see the different types. The first type is all the documents that are contained in the Received Documents tab, which essentially normally are all the documents that have been scanned by a member of your team. So if I click on that tab, I'll see that currently there are 2 documents in Mr. Caron's chart. What's new now is that since we invited Mr. Caron to the portal and we properly synced it, now there's a new icon for the portal that has appeared next to each document in the portal under the portal column. And that's the icon that we will use to share the document with Mr. Caron. We can also note that there's already a comment that we wrote for one of the document. So if I click and I want to share that first document, I will click on that icon. What I'll see now is first I can see that by default the document is checked. So by default I will share the document with the patient. Now sometimes you don't want that. You want to send a message to the patient, but you don't want to send the document because sometimes they can maybe misinterpret some results and worry uselessly. So you could uncheck that, of course, and just send a message. Please call me normal results, for instance. That's one way to go. Also, there could be, as I said, there could be already comments that your team member or you as a doctor wrote. So you can also share that comment by checking it if you want. But if it's an internal comment that you wrote for yourself, you can uncheck that. So you could see that by default, this comment was not checked, and you can send your own message. As I said, you can type it, but of course, there's a way to go faster. I can go and click on select from list. And at that point, I can configure for myself some clickable text menus. In my case, I have one for results, and where I can click and say, I reviewed your results and everything is normal, for instance. Once I do that, I'm going to click to make sure the document is there and click on Sync to Portal. Now, once I do that, a notification has been sent to the patient, and we'll go and see that notification in a minute. I want you to understand now that the icon now is deep blue, and there's an orange circle. That means that the document was properly shared with the patient portal account, but that the document has not yet been seen by the patient. It's important when we share documents to ensure that they are seen by our patients. And again, at the end of the webinar, there's another way on how to manage all the items that you share to the portals, and I'll finish with that. So let's look at on the patient side now. So I will go back to my email, and as a patient, I received a new notification, a new email that's telling me that there's a new document that is available in my account. So I will click on that email. Again, there's a message, and that message, what you can see from that point is that there are no medical information that you can see in the email. It's only an invite to go and consult the document in the patient's in my account. So I will click here on the button, and that will bring me to the login page. So now I have an account, so I have to log in, and now I have to remember what email address I used, which is this one right here. So just for simplicity, I'm gonna copy paste it, go back here, and click on, I'll just switch to English, and then log in. So now I'm logged in. It was quick because it's a document. What I want to show you is when I log in into my account as a patient, and there are new messages or document, there's a little red icon with the number of notifications that I need to verify or to visualize. In my case, in the document, I'm here and I can see the list of the documents that have been shared with me, namely the document that we shared. In my case, I can see the comment, and I can also click here to see the document itself that I can visualize. And the patient can also print it or download it in case the patient wants to keep history of his medical data on his device. I will close that. So that's really on the patient side. That's where you can find all of the documents that have been shared with the patients. And again, on the right-hand side, you have the recent activity. And you can see though, so there's a history that the new document was shared with me today. If we go back to MYLE now, I'll go back here. I'll change tabs in my patient chart just to refresh the information. So now we can see that there's a green checkbox that's associated to the document, meaning we share the document and the patient actually saw the document on his hand. So basically, that's really how we share a document. That way of going is the same for all the other types of documents that you can share. And what are those types? Well, you can share results as well. So if I go back to the tab results, my patient has a results in his chart that I can proceed in the same way. I can click on the icon. By default, the lab is checked. And again, I can include or not the existing comments that are there, or I can type a new comment myself, a new message for the patient. It's important here to mention that we will not share the granular view of the lab. By that I mean this is the granular view that you're used to play with to validate your results. What we share with the patient is the actual PDF that's attached to the lab results. That's what the patient will see. So that's important to mention at that point. But regarding the method, on how to share, it's the same thing. I'd like to attract your attention that when I'm in that view and reviewing the results, the portal button is in the left bottom corner. So that's also where I can share the lab results. And of course, when you are reviewing your different results from the top results tab and you're in your grid of new results, you can click on a lab, and you will be able to share it. If I'm with an actual I'm with demo environment right here, so you'll see again the portal icon in the bottom left of your screen. That's also where you can share the results. So that's the second type. We had the documents, we had the results. A third type of documents that you can share are bills. So I'm back into Mr. Caron's chart. If your clinic uses private billing, you know you can create billing from the history tab, which is the second from the top. So I'll go there, and under the private billing tab, I can see that there's already an existing bill in Mr. Caron's chart. The bill is closed, which is important because if the bill is not closed, you won't be able to share it to the patient. But in that case, it is. So I can again click on the portal icon here, and again, same way really. The bill is checked by default. In that case, you want to share it with the patient, but you can uncheck it for some reason, and then you can add a message either by typing it, or again, I want to say that you can always use clickable text to type your message and sync that to the portal quickly. And again, I want to mention that it's the same color code for all type of documents. So essentially, you'll have a blue icon, and you'll have another core icon in the top corner that will tell you if the document has been seen by the patient. So that's really the same way for all type of documents. Now, at that point, an important question that you probably have is, can I share first forms that I write in my clinical note? Can I share prescriptions, and can I share requests? The short answer is, at the moment, you cannot share forms, prescription, or requests. I want to say that our team is really aware of that need, and that we will develop soon that functionality so that you are able to share those documents. Now, we have a workaround to allow you to share forms through the portal, and it's important for me to show that today to you. So bear with me. We are going to go back to the first tab, the chart of the patient, and I will create a new note as I would to create the form. So I click on new note. I will fill my note, of course, as you are used to, and I will go in the form section. Now in the form section, I'm going to pick one, let's say it's a scan that I want to share with the patient. So I'm going to click for the CT scan form right here. I'm going to fill that. I'm going to save that just to be sure. And instead of saving and going back to my note, here I can print it, as you know, but I'm going to download it, which is the little icon here at the top corner. So stay with me. If I do that and I click, you'll see in the bottom of my screen now that I downloaded the form on my computer. Okay, so I'm going to close that right here, and I'm going to go to my received document, because we know that all documents in that section can be shared with the portal. So basically, it's like adding that to the received document tab. And to do that, again, it's a little refresher. I'm going to go on the corner, the left margin, and click on the cross. That's how we attach a new document to the chart. It's already in Mr. Caron's chart. I don't need a responsible provider. I'll go quickly. I'm a source. It could be a hospital. It could be Medfar Hospital in my case. And then it's the source. It's a request that I want to share. And in the description, I'm gonna first categorize it. In our case, it's a request for imaging requests. I can add a description. It's a CT scan, I think, and I can attach my document. So if I click here, I can go back to where I downloaded the document, which is in my download folder. I'm gonna pick it right here today, attach it, and click at the bottom right on the attach button. I'm gonna click now on all document in the top corner right. So I'm going back to my list now. That's as simple as that. It's a little bit more clicks, but once you're used to, it's quite quick to add a new document, which is the form, and now I'm available to share with the patient. Of course, you could ask about the signature. You can sign the form if you have a tablet directly on the form, but it's not always accepted. We're aware of that. Another alternative is really to fill it on paper with your signature, to scan it and add it to that section. Basically, the goal is to add the form in that section, because from that point you can click, as we've seen previously, you can click on the portal account, you can link the form, and you can add your message, and you can sync that to the portal. Okay, so that's a workaround. And again, going back to prescription, going back to requests, remember that those functionalities, I'm talking about the prescription here and the request and consultation request, they can be directly faxed to the organization that needs it using the MYLE web fax. So prescription, you can fax that directly to the pharmacy instead of sharing that extra steps with the patient that can print it and then have to go to the pharmacy. Remember that you can configure the preferred pharmacy in the chart, and that you can use the MYLE fax web that we have activated for our entire community for free. You can use that to share the prescriptions and send them directly to the organization. Same thing as I said for requests. So remember that. We also have webinars and didactic material on that functionality if you're unfamiliar with them. So that covers how we can share the documents with patients. Again, we can share documents, we can share labs, and we can share bills. And there's a color code here to ensure that the patient have seen those documents. Now, our last topic is now that we've shared many documents for many patients in that fight against COVID-19, we want to make sure that those patients see the documents, and we don't want to go in each chart to go back to the document section and the lab section to see if the notifications, the portal account is actually with the green checkbox. Okay, so to help you save time, we've grouped in the portfolio tab, we've grouped all of the items that have been shared to the portal, and you can access those on the left margin by clicking on portal and then on pending items. So if I click here, what I'll see is that will be the complete list of either messages and documents, which now remember that I didn't show you how to send messages. We'll do that in a minute. But here you will see all the documents and messages that you have shared with the patients with their color code. So of course, all of those have the icon with the orange little circle, because those documents or messages have not been acknowledged by the patients. There's a difference in the color, as you can see, of the rectangle. The rectangle that are deep blue mean that there's a document that is attached to those in comparison to the other, which are actually only messages that have been sent to patients. If it's a document that has been shared with the patient and you just want to send maybe another notification, because at that point you can call the patient, or you could send another notification by clicking on the icon right here. So you will see the document that you shared, you will see the comment that is shared, and you can send from that point a new message. Please review document. Again, you can use the select from list at that point, and you can sync that to the portal, so the patient will receive a new email, a new notification, just to make him aware that he has an important document to review. Okay. Other useful tools here is you'll say, okay, but I'm looking for a specific document for a specific patient, and I don't want to go through my long list. So for that, we have different tools. Of course, you can first click on the little geared wheel icon here, where you have different configurations, as you know. Now you'll be able to filter the item type. So I could say, okay, let's look at only the documents, for instance, and now my grid has updated. You can also use the search bar here to search for a specific patient, for example, Mr. Lanouette. So I can type the name of the patient, and I will be able to quickly find it in my list. I can also search by the description of the item as well. So it's really useful to use these functionalities. So that's how you manage all of the shared items. Now, as I said, that made me realize that we didn't cover how to send documents. We've seen how we can share documents, but we didn't see how we can send communications and only messages to patient. And it's an important functionality. So I will go back to my chart of Mr. Caron. And it's really simple how you can send messages. It will be using the same icon in the top right corner of my screen that we used at the beginning to invite Mr. Caron to use the portal. So if I click here, now, first of all, I have some account details, so I can see when was the last login and the status of the account that's now active, and the email address of the patient. And right here, really, I can type my message. So new message, I can type it. And again, you can use select from list to quickly type your message and then send to portal. So if I do that, it's the same dynamic as for the document. So the patient will receive a notification inviting the patient to go in his account and visualize and the message. But also you can see, you can have a history in the patient chart of all the communications, all the messages that have been shared with the patient. You will be able to find that again in the history tab. That is the second tab from the top. We'll go and see that. So if I'm here, we were in private billing earlier, but now we will go in the communications tab. So if I'm here, you'll see that the message that we just sent to the patient is right here with the person who sent the message as well as the date and timestamp. You will see the message here, and you will see again the status. So again, we can see that the message has not been seen by the patient. So as you send more and more messages to the patient, you will have the entire list here. Some of them will not be shared with the portal, some of them will, and those that have been shared, you will be able to monitor their status. Again, that sent document, that sent message, excuse me, you can find it in the portfolio where we were, because it has not been sent now. You'll see that it will be added to the list in order to track the status of that. So if I go back to our content of today, so our agenda was to cover what is MYLE Patient Portal. So again, it's a web page that us at Medfar we've created and associated to your MYLE environment. Okay, so it's linked only to your MYLE environment. It's a web page that your patients can access to look at their activity, look at their documents, and it's also where they will go if they want to create their own accounts. Okay, we've seen how important it is to make sure that the portal account is properly associated to the patient chart. We've seen that from the moment that your portal is activated, you can start inviting patients through their charts, or you can invite your patients to create their own account, and you will have to do that linking process as we saw. Of course, we saw how to share the documents that are scanned, the lab results, the bills, and we've seen a workaround on how to share forms. We've seen how to send communications, and we have seen how to, you can from the portfolio manage all of the shared items. So this was the content of today's presentation. Really, again, I wanna thank you in my name and on the name of Medfar Clinical Solutions for all of your contribution in the fight against COVID-19. Before I move to the question section, I want to say that we have opened a new support line with the same support number that is dedicated to support you with your adoption of MYLE Patient Portal. So feel free to use that line whenever you need it. So that concludes. I want to thank you for your time today. And now I will move to the section of questions. So now I can see that there were no questions on this webinar. I really hope it was clear. Feel free to share comments with us. And again, feel free to use our dedicated support line whenever you need. On that, I will wish you a great day.